Okay, here's my surroundings. Just gonna set it up right here. Hopefully you can see me. Okay. Hello, my name is Mackenzie. I'll be your student nurse today. Provide for privacy, wash my hands. Can I get your name and date of birth? Okay, do you have any allergies? Alright, I'm just going to check your wristband, and that does match up. So I'm just going to check my physician's orders, and it shows that we can give you some Zofran. I know you've been having a little bit of nausea today, so I'm going to be giving you that. Are you in a comfortable position? And do you have any questions before we start? Okay, so first I'm just going to go over the medication itself. Okay, so it showed in our situation thing that we're giving 4 milligrams, and then the vial comes in 4 milligrams per 2 milliliters, so we'll be giving 2 milliliters. And it does say in here that, to give the medication 4 milligrams over at least 30 seconds, but 2 to 5 minutes is preferred. So we'll do the 2 minutes since that is preferred, and we'll do 1 milliliter per minute for that. So this medication is an antiemetic. It is a 5-HT3 receptor antagonist. So it does not need to be diluted. That is not required. Compatibility. It does say do not mix with alkaline solutions as a precipitate may form, but it is compatible and stable for up to 48 hours with D5W, normal saline, D5 half normal saline, D5 normal saline, or 3% NaCl injection. Some indications for use. We are using it for nausea and vomiting today. And then it does say that it is hypersensitive, or contraindications is hypersensitivity to ondansetron or any of its components, and then accompanying use of apomorphine is a contraindication. It does say to use caution in patients with hepatic impairment, and that it may cause ECG changes, including QT interval prolongation. Serotonin syndrome has been reported with these antagonists, so we have to monitor closely for that. Some signs and symptoms of serotonin syndrome is going to be agitation, delirium, hallucinations, diaphoresis, dizziness, etc. But we also should make sure that they ambulate slowly to avoid orthostatic hypotension. And then some drug and lab interactions. It does say that phenytoin, carbamazepine, and rifapine increase clearance and decrease levels of ondansetron. And then the accompanying use of apomorphine may cause profound hypotension and loss of consciousness. And then it does say to use extreme caution with diuretics or antiarrhythmic drugs that may lead to those prolonged QT intervals. Some side effects, some common ones of this medication are diarrhea, fever, and headache, but constipation may occur as well, so we gotta make sure to check for that. Some other ones is agitation, arrhythmias, chest pain, cramps, dizziness, drowsiness. So yeah, if you have any of those, please let me know. And then an antidote is going to be that most side effects are treated symptomatically, but we are going to keep the physician informed as indicated. If symptoms of serotonin syndrome occur, we're going to discontinue use and initiate supportive care, and then we'll treat anaphylaxis and resuscitate as necessary if there is a problem. Okay, so I'm just going to make sure to check all of my supplies here, that everything is intact. Alright, so I'm just going to wash my hands again, put on my gloves. I'm going to pretend I have a second glove. So I'm just going to assess the site here. Do you have any tenderness? Okay, and then checking for any phlebitis or infiltration, like any cooling sensations or anything of that sort. And it looks like that's okay. So I'm going to take a look at my vial, make sure that it's not expired, that everything's, that it's the right medication, etc. So I'm going to take my alcohol swab and swab for 30 seconds on top. 30 seconds has passed. And then we're going to use our blunt needle for this. Connect it to our syringe. And then we want to make sure that we draw up that 2 milliliters of air. Oh. Stay in there, there we go. Okay, so then we'll insert it. And then push in that air, flip it back over, draw up our 2 milliliters. There we go. And we've got 2 milliliters. And then we'll put that back on so that we can throw this into the sharps container. Okay, so we're gonna have that ready to go. So I'm just going to first swab our site here, our J-loop hub. We're gonna scrub this for a full 30 seconds. Scrub, scrub, scrub. It's been 30 seconds. So then I'll grab my saline flush here, make sure that all the air is out, and then connect. And then we want to check for patency. So I'm just going to pull back first, see if we got that blood return, which we do. And then we'll insert our 10 milliliters using a push-pause method. Okay, we got the full 10 milliliters. And then we'll use another alcohol swab to scrub again for another 30 seconds. Oh, that wasn't supposed to come undone. Theoretically, this would stay in the patient's arm, but this is not connected. So, let me just get this back together. There we go. Okay. Moving on. We're going to do 30 seconds of scrubbing here. Scrub, scrub, scrub. 30 seconds has passed. So then we'll use our medication here. And again, this is going to be given over 2 minutes. So we're going to do 1 minute per milliliter. I'll check my watch here. Oh no, sorry about that. Okay, still checking, so it's been 1 minute. And we'll be given the other one within 1 minute. And for time's sake, I'm just gonna say it's been 1 minute, give the rest there. Okay, so then we can take this off. And then we're gonna use our third alcohol swab. And swab our hub. Full 30 seconds for this one again. And then we're gonna put our second saline flush in, and we do want the same amount of time as our medication for this one. So we're gonna give this over the full 2 minutes using that push-pause method. While we do this, we do just want to like make sure that they're not having any type of reaction to the medication, which is why it's good that we give it over a slow period of time. I know this medication, that's why it's preferred to give it over 2 to 5 minutes rather than just that 30 seconds. And we'll say for time's sake, it's been 2 minutes. All right, do you have any questions for me about what we did today? All right, so again, we're just going, oh, sorry about that background noise. We're gonna make sure that this is locked and that the patient's in a comfortable position, doing our safety checks, and then just making sure that they are okay. Thank you.